Hello, good morning. Everyone can hear me? Okay, great. So my name is Debkishore Mitra, CTO, co-founder of Diassess Inc. We are a medical devices startup company working on developing the next generation of diagnostic tools. So this talk is going to be a little different in terms of scope and pace because I don't have any money to give in projects, dilutive or non-dilutive. So my talk is mainly focused on discussing Diassess's non-dilutive funding journey. So this has been a 6-year process at this point in time. So 30 minutes, I'm going to run through some stuff really fast. Please feel free to ask questions and interrupt if there's any burning desires to do so. So before I get into the non-dilutive funding story at Diassess, I wanted to sort of talk about us. Diassess, who are we? So the slide here sort of summarizes our history in terms of certain key milestones and dates. The company was founded in 2013. A lot of the initial hires, key hires and key IP development was funded through an NIH Phase 1 SBIR. That initial funding allowed us to hire key people, join a lot of nice incubators and other facilities that are available to us in the Bay Area here. A lot of that work led to follow-on funding from NIH and NSF, both Phase 1 and Phase 2 awards over the period of the next 3 years, private funding, seed as well as Series A funding. And then finally, some of the key milestones in terms of technology development for moving from feasibility phase product into a system integration product. And a lot of this effort culminated last year with a BARDA contract that we are super excited to be working on developing at-home influenza diagnostic tests. So at Diassess, our mission is pretty simple. We want to break down barriers to healthcare, to enable and empower patients to take charge of their health. And we believe that can be done if patients and consumers are enabled to manage their healthcare at their own convenience and without a lot of excessive costs. But the main question is, how do we wish to achieve this mission? What is our vision? Where does Diassess fit into the molecular diagnostic marketplace and the framework? Now, molecular testing market is a very complicated market, so I'm going to try to summarize it in 3 slides. And to do that, I'm going to utilize a visual tool that I am blatantly borrowing from Clayton Christensen's great book, Innovator's Prescription. And you're going to see a lot of these sort of washed out but 2D planes. And each plane is what the book calls as a plane of competition. I'm going to just refer to as a marketplace. So molecular diagnostic testing universe has a bunch of different marketplaces. Now, each marketplace will have certain competitive drivers. What drives innovation? What will lead people to adopt your technology and your test? And those will be represented in those 2 axes there. And you will see that as a marketplace matures, you will see innovation moving from the lower left corner of that plot to the upper right corner, but eventually to a point of saturation, which is denoted by that stop sign on that curve there. So to start the history of molecular diagnostic testing, the original marketplace was the central lab testing marketplace. Here, the main key drivers for innovation was throughput and reduced cost. And a lot of these drivers, in our mind, pushed innovation away from manual testing into automated high throughput equipment. And there has been a lot of work being done over the last decades to make systems that can fit in more tests, fit in a wide variety of tests, and to reduce the per test cost. But eventually, with a lot of this innovation, the development got incremental to a point where we do see a saturation in that marketplace for molecular testing. And that led, that sort of saturation made the marketplace ripe for disruptive innovation. Now, not to belabor a term you must have heard a billion times, but in my mind, disruptive innovation is basically anything that enables this next plane to come up. And in molecular testing, this next plane or next marketplace was point-of-care testing or near-patient testing. This allowed a whole avenue of innovation to come up, but this was only enabled through disruptive innovation, which allowed technology to be miniaturized, automated, made to fit in the footprint of a point-of-care lab, but also through assay development activities, through stabilization, sample prep, chemistry development, that allowed all of this to happen outside the confines of a central lab. Now, in this marketplace, the two main competitive drivers are the ease of use. You obviously do not want physician office, doctor's office personnel to have to go through the extensive training that central lab personnel go through, and test speed, because the main driver in these marketplaces is to get the result out to the patient during one doctor's office visit. And what we have seen in this marketplace is the same sort of evolution, where technologies moved from a clear, moderate, near-patient 90-minute test platform into the earlier eyes, which are clear wave test platforms in less than 30-minute time to result. Since earlier eyes came into the market, there has been a lot of other developments, incremental in the sense that they do improve the time to result and the size of it, but they do not really lead to new paradigms in testing. And this is where we think we fit in. So the next paradigm in testing, this next plane of competitiveness that we at Diassess believe is imminent, is the at-home and or on-man testing marketplace. This is a marketplace where testing will be done outside the confines of traditional doctor's offices, physician's offices for certain disease types that obviously offer themselves to such kind of testing. This will also be supported by a framework, a network of other resources, some of which were referred to in previous talks, like Amazon-based delivery systems for healthcare tools, Amazon-based or other telemedicine-based providers for medicines and other such tools. At this point in time, in this marketplace for molecular testing, there are no players. And hence, I would humbly submit that we are a platform, we are a disruptive innovation that is going to make this marketplace possible. And that is where we see us fulfilling our mission. We see us fitting into the marketplace as the first at-home molecular testing system. So what is our system? So this is a snapshot where you can barely make out some boundaries, but basically it's a completely disposable handheld system. What you see in the image is all you need to run a test. You do not need an instrumentation, you do not need any tethering. Everything can be taken out of a box, used and disposed of. The units for such a test include, so this one is the influenza test that I'm showing here. So you will have a nasal swab which will collect the sample at the point of care at home. And then the sample goes into our sample preparation unit and detection cartridge. These units are completely handheld, completely disposable, and can detect a wide variety of multiplexed RNA or DNA markers. And that detection is done using a patent-protected colorimetric chemistry that allows us to simplify our optics significantly from fluorescence-based detection, so that the optics can be incorporated into this handheld format, in a disposable format. The results are shown in an LCD screen for completely non-ambiguous determination. And the entire thing is battery powered. So you do not need any tethering or any sort of wall power requirements. The other thing that we are working on is to enable the ecosystem that I was talking about. Like, you have the result, what happens next? That is where we are putting in a lot of resources and working with BARDA and in partnership to work on mobile app developments. These will basically enable the user to connect with a wider audience based on this data that they have on the device. So what we envision is a system where one day you will have an app that will show you the output of your test result and will allow you the option of contacting a telemedicine provider that can verify the disease state that you have, that can prescribe you the medication, and then you can connect with an online pharmacy where the drugs can be provided to you without you having to leave the confines of your home. So this direct digital prescription is the ecosystem that will be enabled by a disruptive innovation such as the Diassess test platform. There are other secondary benefits in this ecosystem. The other one is real-time data. As you collect this kind of information, you can generate heat maps, you can generate geo-tagged data sets, which can enable users to understand how the disease is progressing in their environment. It will also help in prevalence monitoring in terms of public health clients as well as pharma clients. It can help you plan out stockpiling or supply chain issues. And at the end of the day, it's a very good consumer acquisition tool for tests such as these, because once the consumer wants the data, then the consumer will also be motivated to contribute to the data pool if they feel sick. So this is a wide, high-level overview of our device disease platform. It is applicable to a wide variety of different disease targets. We have worked with NIH on STD development. We are working with BARDA on flu. We have this platform also is amenable to on-man testing in the on-field testing, biothreat detection, and a wide plethora of other application areas. One that I'm going to focus on, given the audience today, is the work that we are doing with the BARDA contract on at-home testing, influenza testing. This is a slide copied from BARDA Industry Day 2018, mostly because it's a very good summary graphic of everything, and secondly, because we are featured pretty much centrally in the slide here. And the main idea here is that the mission statement for at-home influenza testing is to reduce transmission by reducing the time to diagnostic testing. And the biggest barrier on that time is the ability or is the drive of the patient to actually go and seek out medical attention. And once you have that faster diagnosis, you will have reduced transmission. At the same time, the back-end data set here can be a very useful tool for governmental agencies who are monitoring pandemics, because that can allow them to predict or detect outbreaks before they become very problematic. I know we talked about flu previously, but this is our infographic as well. Busy slide. Main points here is that everyone hears about flu. Everyone hears news articles about flu. Everyone thinks they will never get the flu, but they do. And that is the cost that you see here, is that like billions of dollars in cost, not only to the healthcare system, but also billions of dollars in lost wages that affect individuals. Not to mention the thousands of deaths that are caused due to influenza infections. And in this marketplace, what you do see is this vicious cycle of poor treatment options that lead to poor decision-making and poor outcomes. So for example, I give two examples here. From a patient perspective, there is a lot of wasted time in going to physicians, going to your doctor's office, and hence they wait till the last minute when they feel really sick. And the vicious outcome of that is that you only have very sick individuals going and seeking care in these outpatient clinics, where these outpatient clinics do not want these individuals anymore because they are a threat of transmission right now. So it's sort of this vicious cycle that feeds on top of each other. The second one is the cost barrier. If you do not want to go to your doctor's office, if you want immediate gratification, you go to urgent care. Well, urgent care is expensive, and that is a cost barrier that prevents a lot of people from seeking this, this option. But without seeking this option, they actually lose wages, which then affect them on an income level as well. So it's sort of these two examples of how the unavailability of a good treatment option is leading to poor outcomes in general in the marketplace. So where we think we fit in is with our belief that having flu should not be time-consuming or costly. We see ourselves as the third sort of way for a patient to get to treatment. The first two being going to a doctor's office, which takes a lot of time, or going to urgent care, which is generally very expensive. We envision ourselves being in this ecosystem where an individual can get tested at their convenience at home and get treatment options readily available if they have the influenza. So this was the first part of the talk. I hope I was able to give a broad overview of Diassess as a platform technology and as this application area of influenza testing. The next phase of the talk, I'm going to talk more about our non-dilutive funding journey. I do feel like I'm preaching to the choir. Everyone here hopefully knows the importance of non-dilutive funding. So I'm going to focus more on our specific learnings in the process. I hope it is of some relevance and importance to some of you in the audience here. So in terms of non-dilutive funding history, the slide here sort of summarizes our history thus far with non-dilutive funding. These are cumulatively, we have been awarded $26 million in government grants and contracts. As you can see in the plot here, a lot of these grants and contracts came in at very critical times for the company and allowed us to move from different development stages, move from different company stages. Like the first grants allowed us to get the key IP done. Then subsequent grants validated the technology enough for us to get private financing to expand the team. And throughout this process, we have been able to expand the technology readiness level, or the TRL of our core technology, from a TRL level 2 to a TRL level 6, that then allowed us to then go and get a contract because of the maturity of the technology that we have. So in terms of lessons learned, I think like the first lesson that I would like to share here is an understanding of the difference between grants and contracts. This is by no means a comprehensive list. There are like hundreds of points of differences, but these were the ones that were important to us when we were trying to decide what is the appropriate funding opportunity for us. So grants, and here by grants, I'm referring to SBIR, SCTR grants. And contracts, I'm referring to contracts such as the BARDA contract. DRIVE, as we heard, is a newer entity, a different entity, does not feature here. It is sort of like, it takes advantages of both systems, so it's a great new endeavor that's coming up. But in terms of grants, I think the big thing is to understand the purpose of each of these funding agencies, because that will help decide whether it is the right fit for you or not. Grants in general are, by definition, have a broader purpose. And you can see that in solicitations. You do not have very specific problems that you're trying to solve in a grant, but very general areas of interest that allows a lot of wide variety of technology to be applicable. And that is, in general, the purpose of a grant, is to expose the government agents and the federal agencies to a wide breadth of innovation, which they can decide to fund to the next levels. Contracts, on the other hand, are very focused on providing a direct benefit. So they are trying to solve a problem. And if you see a contract solicitation, you would see that the problem statement is much more clearly, narrowly defined. And making sure that you are a good fit with that problem statement is useful to not waste your time or waste the contracting agency's time, because they are very particular about what the fit needs to be. This is where things like BARDA Tech Watch and other areas where you can get feedback from program managers is useful to make sure that your purpose and the federal agency's purposes are synced together. And another outcome of this is that because grants do try to cover a broad range of innovation, on a per grant level, the amount of money you're going to receive is capped, is limited. But on a contract, because they are trying to focus on innovation that has the highest likelihood to succeed, you do have a larger budget to work with. The second one was the scope of work. In grants, the scope of work is pretty much decided by and defined by the PI, unless there are some really glaring technical issues with that that come up during grant review. Your scope of work will go through unedited. And that is important, especially when you're trying to do high-risk research, because it gives you leverage to define what are your metrics, what makes sense for you as a researcher and what makes sense for you as a company. It also provides you, the PI, with some leverage on changing the scopes, because the reality of the situation is what you planned out to do doesn't always work. And you have leverage to make sure that you try different options out. Contracts, on the other hand, the scope is pretty, there's a heavy hand definition from agencies with collaboration with the companies, but there are very clear milestones, deliverables, very clear measures of success. And any deviations from that scope usually requires a broader discussion with the federal agency and the program manager, which is great for later stage development, where it's very easy to have a charted out list of activities that you would like to do. The first 2 points, basically, in our experience, enable grants to fund very early stage TRL2, TRL3 research, whereas contracts are much better to fund verification, validation studies, things that are needed just before you go into market. The third thing, which is more of an operational thing, not a research thing, is budgets and cash flows. Grants are a flexible budget instrument. They do provide you with a drawdown account, so that once you expense any items, you can get the money back within a week or two. Contracts, on the other hand, are more of a goods and services agreement. There are a lot of operational steps that you have to take, which makes sense because you are dealing with larger amounts of money. And there's an invoicing system. So as a company, as a startup company, if you're thinking of contracts, should be aware of how does that invoicing fit in with your cash flow plans? How does make sure you do financial planning to account for the difference of time between when you submit an invoice and when the money comes to your bank account, and a few other such items. So that was sort of a first big lesson over the last 6 years, is understanding the difference between the two funding sources. The other big thing that we were faced with is that while grants, the timelines are a lot of information is available on when are the funding deadlines, how long does it take for review, when do you expect to get funding, and you can plan accordingly. For contracts, that information is usually not very readily available, and that is because contracts by basic definition are very subjective. It depends on what you're proposing, depends on the budget, it depends on how quickly you can work with the federal agency. So the purpose of this slide is to throw one more, I guess, data point into the ether here of what our timelines look like. Again, keep in mind, subjective, this is for us. This is by no means what you should expect. But in general, what we saw was we did a tech watch in March 2016. That was very important for us because it got us a lot of important feedback on how our technology can fit with programmatic needs from BARDA's perspective. Then it took us around 6 months to sort of hash it out, refine it, and create a white paper that we thought would fit in with their programmatic needs and our technology capabilities. That was submitted early 2017. By mid-2017, we were invited to submit the full proposal. The happiest day of 2017 for me. It was great because it was like a validation of all the work that had gone into it before. But next day, it came with the realization that we have a month to prepare almost 200 pages of documentation. So that is where identifying partners was very important for us. FreeMind was the partner that we decided to work with to help us through that process. So FreeMind engagement pretty much happened within a week from that announcement, and they were a great resource for us, providing us not only demystifying a lot of things in the contract process. They have a team in Israel as well, so we were basically on 24 hours. We wake up in the morning and have documents ready from Israel, so which was great. With all that help and all that effort, we got our full proposal submitted in June. Again, based on strategic feedback from FreeMind, we decided to follow up with developments because we wanted to show that we are actively working on the project, we are making headway, we are making improvements. A proposal update was submitted in November, and we learned in December that we have been invited into contract negotiations. That was sort of the next phase. So you can see there's a white paper phase, the full proposal phase. This is the contract negotiation phase, was the phase that we, as researchers and grant writers, were the least prepared for, because NIH and other funding agencies, you don't really go through that process. You maybe get asked a few questions, or why is your budget not appropriate, or if the numbers are too low. You get a few feedback, but not the extent of contract negotiations that we went through with BARDA. We discussed everything from scope of work to budget documents, supporting information, everything. There was a site visit that was involved, which I thought was a good thing for BARDA to verify that we are real before the money goes out. And then finally, our contract was submitted in July. So 3 phases is basically the take-home message from this slide in terms of contract, in terms of the contract timeline. The next 2 slides, I'm going to just run through some key lessons learned. Some of them are cliché, so forgive me for putting them up here, but you need to, I have to reaffirm that. Persistence is needed, and you need to listen to feedback. Nothing will happen the first time you submit it, and sometimes feedback will not be easy to digest. You are subject matter experts for your own technologies, but there are other subject matter experts that exist in the ecosystem. I have been reviewing grants as well, and I do understand, I have seen this other side of the schism, and I do firmly believe that listening to feedback, improving your proposals, making sure that you don't get too demotivated very quickly, because it's going to be an optimization game. Knowing your agencies is very important. Go to events such as this, meet with agency representatives, set up tech watches or other formal feedback sessions if you can. Reach out to program managers at NIH. They are very accessible and they can talk through a lot of the programmatic needs that they are looking at, etc. Make sure you do not submit. The worst thing you can do is submit something without actually knowing anything about the agency, because you are bound to not get through in that case. Fourth thing, identify partners, not only technical but operational. Like for us, although our team is 40 strong, we like to believe our family is a few hundred because of the number of partners that we work with on a day-to-day basis. Partners such as FreeMind, who can help with the grant writing or opportunity finding exercise, partners such as collaborators who can give validation to your technology, who can be early adopters of your technology, etc. The other thing I also want to point out here is that with NIH, although SBIR is the most commonly used grant tool that I hear a lot of entrepreneurs using, they do have STTR tools. That gives, these are tech transfer like grants, that gives higher weightage to academic collaborators, but that is also a very good tool to bring in collaborators into your mission because they have a financial incentive to work with you in that case. The next one is having a clear go-to-market strategy. This is sort of like, again, one of those cliche things, but again, want to reiterate, I have heard feedback when I was writing grants that no one reads the commercialization sections. So people just copy paste, and just make something very boilerplate. The fact of the matter is that's changing. I think being in the review rooms ourselves, things are getting competitive enough that unless you have a very clear commercialization plan, that can weigh heavily in against you in review process. For a contract, especially a BARDA contract, where if they're looking for a product in the market, you need to have that clearly understood, at least on a higher level. Again, you are not expected to spend tons of money marketing and stuff already, but have a good understanding of what the marketplace looks like. Next one has bitten us many times, so want to make sure everyone is aware of that. Budget adequately. I think for young entrepreneurs such as me, it was very hard because we come from a research environment where budget is the last thing you think about it. You talk to your PI, the PI talks to the grant administrator, everything is hidden from you. But in SBIR, STTR grants, you have to be responsible for it. You cannot just put a 7% G&A rate because you have to fit your budget into a certain window and then realize that you don't have money to pay your accountants. You have to make sure that you have a comprehensive budget. You have your research budgets, that's all fine and good, but know your indirect rates, know your G&A rates, know all these other boring operational things, because that otherwise, once the budget is gone through, there's a lot of work that you have to do to make changes to that budget. And that ties into the next one, is understand what are your resource needs. You're a startup. Are you part of an incubator? Do you have financial backers in private sector? Do you have accounting services? Do you have program management services? Do you have data management support? These are all things that are drivers of success, not only your idea. And if you do not budget and plan for them accordingly, that can actually be detrimental to the success of the project as a whole. A few more feedback or lessons learned, mostly focused on the BARDA contract here, is the concept of cost sharing. Is something that you do not hear a lot about in grants, NIH, NSF grants, but in contract space, cost sharing is pretty common. And what that means is that on a dollar-to-dollar basis, you are paying a certain percentage of all project costs, which basically means that you need to have other sources of funding to support you. You need to have private funding, or you need to have some other revenue coming into your company so you can actually promise a cost share. I have spoken with entrepreneurs who basically want to give whatever is the minimum required cost share because they want to get through the door. But once you do that, you have to back it up during contract negotiation with evidence of financial support. The scope of negotiations I already touched on. Want to give a shout out to the BARDA staff and SMEs. I think before we went through the process, they were sort of like the boogeyman for us. So we didn't really know how much help we will get from them, how much it was going to be a collaborative effort versus it's going to be sort of a reporting structure. And we have been pleasantly, our experiences have been very pleasant with the BARDA staff, with the SMEs. They have provided us with invaluable contacts as well as with a lot of suggestions and feedback on how to improve the program without being on a payroll. Next one is operational needs. Again, touched on it. Make sure you understand all your operational needs. A contract wants you to be as close to a real company, as a big company as you can be as a startup. So make sure you leverage services and tools that provide that as a contract basis. And finally, non-dilutive funding does not mean you do not need dilutive funding necessarily. There are companies that can that have been successful with only dilutive funding, but as a percentage, I would like to I believe that you need to have some other amounts of working capital through private funding or some other revenue sources to make sure that you are able to get your product into the market. And that's it from the lessons learned for the presentation. Big thanks to the Diassess team and to our supporters, and thank you to the FreeMind team for having me over. Thanks.